Hello everyone, I am Dr. Zakir, ENT surgeon. Today's patient teaching program is on a topic called chronic tonsillitis. What are these tonsils? If you open the mouth and see deep inside, you will find two paired small almond-shaped structures. These are the tonsils, like how you see in this picture. These tonsils, they protect us against virus, bacteria and allergy. So in short, they are the policeman of our body. They guard us. What happens is, because of repeated infection, this itself can be a source of infection. It goes into chronicity. So at this stage, if you ask me, what is chronic tonsillitis? It means chronic infection of the tonsils. So why it has gone into chronicity? What is the etiology? What is the cause? So, like how I mentioned before, repeated infection of acute tonsillitis because the acute stage was not properly treated, or maybe the bacteria was resistant for it. The second common cause is there is infection somewhere else which is feeding the tonsil with infection. Like the source of infection can be in the sinus. Chronic rhinosinusitis. The tonsillitis is a disease of the children. So, the most common person, the person who complains will be the mother. The mother says, "Doctor, my child he gets sick. He gets throat pain, he is not able to swallow, and there will be high fever." We take him to the doctor. He diagnoses as tonsillitis, give him a course of antibiotic, and after that he recovers. So I ask him, is that all? She says no. Even after the episode, he says there is discomfort of the throat. So he doesn't eat properly. He doesn't have an appetite. We have to force him to eat. And he has lost weight. He doesn't gain weight. On and off, he gets neck swelling too. So I asked them, does he sleep normally? The answer is no. On and off he gets a disturbed sleep. Means he gets up during sleep. So these are the common complaints from the mother. So on examination, when you see the throat, the tonsils will be enlarged and there will be neck swelling too. These are the common findings when we examine the child. If you leave the child like this, or I just treat the acute infection now, what will happen? He'll go into complications. So what are the complications? He can feel sick or fall sick again and again, like how the mother has mentioned before. Or he may get small stone-like structures in the tonsils, and others can complain there's a bad breath coming from the throat of the child. Or there will be pus formation near the tonsils, or there will be pus formation in the neck. For that, the child need to be admitted, or sometimes maybe to be operated to. These are the common ones. It doesn't stop here. He can have secondary effect in the heart, or he can have secondary effect even in the kidney. So these are the complications of tonsillitis. So it has to be properly dealt with. What are the investigations? You must have heard such and such person has got typhoid. It was confirmed with a viral test. Like that, we don't have a single confirmatory investigation to diagnose chronic tonsillitis. So diagnosis is with history and examination. There is no single investigation. So do I mean to say we don't do any investigation? We do. That is pre-operatively to see if the child is fit for surgery. So once we come to a diagnosis, what is the treatment? The only treatment for chronic tonsillitis is surgery. That is tonsillectomy. So what are the indications for surgery? So the indications for surgery are the tonsils are enlarged and child has got disturbed sleep. He gets up repeatedly again and again in the night. That is one. Or tonsils are enlarged and child had pus formation near the tonsil for which he was admitted. And the third one is what the mother has explained. Like he gets repeated infection of the throat. That is 7 episodes in 1 year or 5 episodes of infection in last 2 years or 3 episodes of throat infection for last 3 consecutive years. So what do I mean by episode? It means the child gets infection of the throat, he is not able to swallow, he has got fever, seen by a doctor, diagnosed it as tonsillitis. That is one episode. So these are the indications for tonsillectomy. So what are the conditions where we don't do surgery? What are the contraindications? Commonly, we prefer not to do or not to operate on a child less than 3 years of age. And suppose there is a history of bleeding, there is a small wound and it bleeds from the wound for more than 15-20 minutes, or there is a family history of bleeding, even then we prefer that we don't operate the child then. We send the child to the hematologist, do a proper workup and follow the clearance from them, and then you operate the child. These are the normal contraindications for the surgery. Now coming to the pre-operatively, what are the things we are supposed to do? So we do a few blood tests, see the blood group for sure, and x-ray of the neck and x-ray of the chest too. Once this is done, we need to take a consent for the surgery. During the consent for the surgery for tonsillectomy, we take consent for removal. Suppose there are any loose tooth, we take consent for that also. Maybe during the procedure of surgery, maybe it will come off. Next is, say by 1.5 hours, the blood reports are ready. With this blood report, the child is taken to a pediatrician. The pediatrician sees the child and gives clearance for surgery. One. With this clearance, the child is taken next to the anesthetist. He sees the child and sees whether the child is fit for anesthesia. So that is done next. So blood test is done, pediatrician seen, and anesthesia clearance we have got. Next is the surgery. Surgery can be a daycare or admission for a day or two. Daycare means with all these reports ready, the family comes in the morning by 5 or 6 o'clock. Surgery is done the same day in the morning, and by evening 5 or 6 o'clock the patient is discharged, goes back home. The second option is, that is admission for a day or two. Suppose the surgery is on Tuesday. Monday morning the child is admitted. You take consent, blood test, pediatric clearance, anesthesia clearance, and child goes back to the room. In the night, he takes a good dinner, either from home or provided from the hospital. Please no junk foods. Advise him to take a lot of water and make him to sleep early, a good 8 hours of sleep. And from midnight, 12 o'clock, please do not give him anything, even nothing to drink. These are the pre-operative advice, and meanwhile, a junior doctor or ENT doctor will come and take a detailed history and examination too. So, the next day, Tuesday morning, is a surgery day. Morning, they change the dress, the OT dress. Child is taken to the operation theatre. It takes approximately an hour and a half for the surgery. Child is brought back to the recovery room, where he or she spends about 20 to 30 minutes, and back to the room. When you receive the child in your room, you will find the child very irritable, crying, small stains of blood in the mouth and blood clot in the nose, and maybe the child could have vomited a bit, or complaining of ear pain, or you feel the child has got fever, the body is warm, and there is a change of voice. Don't worry, this is all part of the surgery. These are all minor changes which you find in surgery. Next 4 hours, you make him to sleep. Don't give him anything. You console him and make him to sleep. This 4 hours, you will find the nursing staff will be visiting you again and again, checking the vitals and the temperature. After 4 hours, they will tell you to give sip of water, and if the child doesn't vomit, they will give you antibiotic and analgesics. Antibiotic, syrup and analgesics. So your diet starts after 4 hours. So what are the things which you can give? You can give ice cold water, vanilla ice cream, jelly, pudding and yogurt. So what are the things you should avoid? Hot spicy food, orange and lemon juice because it is acidic, and soft drinks. So these are things to be avoided. So this is a diet for the day. Next day he takes the same thing, but you can add up soft food also. Don't give him any hard foods and any crispy foods, any spicy, like what I have already mentioned. So next day morning the child is discharged with a course of antibiotic and painkiller, and you will be advised to come back after 10 days to within 2 weeks. Bear in mind, the child is in pain still and you have a painkiller, but still the more he drinks fluid, I said fluid, not water, more he takes fluid and more he eats, the better for him. The pain will be lesser fast. Don't depend on medication alone. The more he eats, the better. And his normal activities are restricted. It has to be within home, and all physical exertion to be avoided for 12 to 14 days. So that's what has to be done. What are the complications for surgery? Complications are, which could have been already explained before, but just in case to be better to be known, it can be the child can bleed either in the operation theatre or even after reaching home. In case is there any bleed after reaching home, you have to bring him back to the hospital and the doctor sees the child, and if necessary he admits, and if necessary the child is taken back to the operation theatre to control the bleed. I said if necessary as per the doctor's decision. Other complications are there are minor trauma on the lips, maybe the tooth or the palate or the tongue, which all heals by itself after some time. And even the posterior wall can be injured with, which heals within a few days. These are the common complications. So postoperatively, in the room also, the most common one, there will be severe pain which will be taken care of. The more you give, the better. Review after within 2 weeks. So happy children means happy family. Thank you so much.